Hey everybody, welcome. This is Jason Clemens, Doctor of Chiropractic at the Rock Health and Wellness Center, and this is Life with Jason Clemens, DC. And we are live right here from the Rock Health and Wellness Center studios in Lubbock, Texas. We're live on the radio at 98.7 Walk by Faith. We're streaming all around the world in multiple different formats, 987radio.com, social media at the Rock Health and Wellness Centers on Facebook, at Health from the Rock on YouTube, and Jason Clemens, DC on X. Hope you guys had a great day. It's been a busy day here at the Rock. Started early with adjustments at 7:30 and got my mom out of the hospital. Her hip surgery went well and she's back home. She's doing great. My sister's in town taking care of her. Really appreciate that. And things are good. We had some great adjustments today. We had some great conversations today. And that's what we're going to talk about tonight. We're going to pick up where we left off last night because I didn't get through all that, the article and the idea of, how diet plays a part. And one of the things I had a conversation with a new patient today about chemistry. We just don't understand chemistry in the body, I don't think. It's joint function is related to abnormal chemistry and abnormal movement. Those two things together. If your elbow hurts, if your shoulder hurts, if your knee hurts, it's not because of abnormal movement. There's also a chemistry part to that thing. And it's hard to understand that. It's really hard to understand it because number one, doctors don't teach it. And number two, chemistry. There's a select few people on earth that really enjoyed chemistry in high school. And the rest of us, I kick myself sometimes because I think, man, I missed out on chemistry. Like, I should have done better in chemistry. Chemistry is the thing that it's like, why does a certain red wine go good with a steak? It's like, why do you put cilantro into something? Or it's like, it's all chemistry, right? And how do you run your cells? How do you run your body? How do you run your joints? So what are all the things that you do? And that's what we started to talk about last night. And I just felt like there was a couple articles I didn't get to. There were a couple of thoughts that I didn't get to. And that's what I want to do tonight. But I want to show you real quickly because we brought the energy ball up again today. I had another new patient. And I showed him the energy ball, and JT came over and helped me. He was in the other room about to get adjusted, and he came over and helped me, and I touched it. So if you guys don't know what this is, and you guys on the radio, you're just gonna have to listen to it. But the energy ball is what it's called. It's a little ping pong ball. It's got a battery on the inside of it. It's got two little electrodes on the outside of it, and you touch one side and you touch the other side, and the ball lights up. I'll put it here in the front of. So you guys on the radio might could hear that, right? That's what happens with the energy ball. And so what happens is if you get someone else to touch it, if I was to just hold it up like this and I was to let you touch it with one finger, nothing would happen to the ball. It would just be dead, just like it is now. But then if we both touched hands with our other hand, so you're facing me and you've got one finger on the ball, I've got one finger on the ball, nothing's happening. But if we touch hands, then the ball's going to light up. So I was showing one of our newer patients this energy ball, and so we did it, and then I said, hey, JT, come here. And so he came over into the room, and I was like, stand right there. Now, touch my finger. And he touched, and then he touched her finger, and then all of a sudden, the energy ball lit up. And what it was saying is that there's energy that's flowing between all of us. That's the way, I saw that with 50 people in my classroom. But what I said to JT at the end, I said, look, this is a subluxation. Like if the ball's supposed to work like that, if you're supposed to touch it and the ball lights up and you just roll your finger that far, like you just roll your finger across the top of the ball, I'm still touching the ball, but I'm not touching the little electrode that's on the ball. I don't know if you guys can see that, but so you just roll your finger off of it, and what happens? You lose connection. You lose the circuit of energy that's traveling through the ball all of a sudden. And it just is such a small little movement. I mean, and now it goes like this. You guys can hear it on the radio, probably not very loud, but like all day long, you're just getting like, instead of it being full speed all the time, you just get that joint off center just a touch. You can just barely get that joint rotated just a little bit. And I had a girl with a crick in her neck. Just got up in the middle of the night, set up, and then just cricked her neck. What I mean, she came in. Which way was she leaning? She was leaning left. Like she was really, really cricked. And we worked on her probably 30 or 45 minutes to try to get that to calm down and got her adjusted. I got a message from her today and she's a little bit better. But yeah, so that little bit of rolling off of there is just a touch. It's like, it's just barely a little bit. That's what a subluxation is. That is what we said on on Monday night, is a state of being in a state less than light, right? This is the light of the ping pong ball, the energy ball. Here's the light. Here's the subluxation. Like, I got one finger, there's the light, there's the subluxation. It's just a slight bit of, it's just a slight little interference. And what does that mean for you and me? What that means for you and me is just amazing. I got a message right here from my new patient. I checked on her, but right before we started the show tonight, just said, hey, I just want to make sure you did good with your adjustment. She said, I did. I can't believe how good I feel this evening. After one adjustment of establishing proper nervous system function, it's like, if you don't have proper nervous system function, you don't function properly. And if you do have proper nervous system function, you almost always function properly. Like there are some acute, I'm not talking about acute pain problems. Like you got in a car wreck, you were sitting at a stoplight and someone rear ends you, or you get bucked off a horse and stepped on your ribs. You do have a subluxation and it's massive and it's really quick, but it's not something that's, I'm not talking about acute pain. Like your nervous system is working relatively fine, but you've got you broke your leg. Okay. I'm not talking about that. I'm talking about, why do your kidneys just stop working? What in the heck is the problem with the gallbladder? Why does the gallbladder work for about 40 years and then all of a sudden, you know what they say in chiropractic school? And you got to excuse me for this one because this is not very couth. 40 fat and flatulent. That's what they say. That's how you know if someone, that's what you got to look at. If they're in their 40s and they're overweight and they've got a digestive issue with, they've got too much gas, that's like the little whatever that you're supposed to remember things with of a gallbladder. But it's like, why did the gallbladder just quit working? Does that make any sense to y'all? Your heart didn't quit working at 40 years. Your liver didn't quit working. Your pancreas that's sitting right there next to your gallbladder is still working. Like, why is the gallbladder the thing that's like all of a sudden just quits working? What is the deal with that? And when it quits working, can we ever make it work better again? Or do we just have to cut it out? Like you are just cruising along there. All of a sudden you have a gallbladder attack, and 48 to 72 hours from now, you've got a gallbladder that's gone. And it's like, wait a minute, why is that happening? Why is it that my foot just doesn't quite bend the way that it used to bend? Or how come what is the thing with this hip? I just can't get this hip to, it's stiff. Or if I sit for too long, then my hip just gets all stiff. Those are the things that go on with the subluxation for you and me. And it really is. It's like life altering. It's a different life experience when you're subluxated, when you have interference in your nervous system. It's a different life experience. And I know how crazy it sounds to say it, because there's not a lot of people out there saying it. Apparently, our guy that was listening to us last night and left some messages, I'm talking about a British osteopath. I got to think about that last night after I got off the show, and I didn't know how to get a hold of the guy. And I was like, I mean, that's really cool. I mean, there's a lot of doctors out there who are really trying to help people be better by really working on the sources of the problem, not just giving them a drug for whatever their issue is. But I know you guys are interested in the solving the source of the problem. So that's why I think it's so cool to like take these articles and look at these articles that I appreciate Dr. Murphy sharing with us. And this is right off the press. This is the one he just released, omega-3 supplementation and its effects on osteoarthritis. But we could do this same conversation, and we could put rheumatoid arthritis, lupus, kidney disease, wrinkles in your face, heart disease, joint problems anywhere in your body, muscle stiffness, Alzheimer's disease, Parkinson's disease, strokes, cancer. You pick the thing, right? Omega-3 supplementations and its effects on blank, because we could take it on any of those things right there. And because it's and the reason I say that is because it's chemistry. It's the chemistry inside the body. Like, okay, what do you mean chemistry? Well, there's a certain amount of one. You guys remember, like, y'all remember titrations in school? I think I've mentioned this before, but you remember y'all remember what a titration was? When you had when you had a solution, you had your beaker full of some clear solution, and I'll see. Whoops. Like maybe I could draw this. There's your little beaker, and inside of it is the solution, and it's clear. And then all of a sudden you start dropping in these one blue, like you drop. You get your dropper and you just drop in one blue drop, and you drop it into the solution and nothing happens. You guys should, if you don't remember this, go to YouTube and look at titrations. It's really cool. So then you drop another drop, and you're counting the drops, right? That's what the chemistry lab was that day. Count the drops. Tell me how many drops it took of this one dropper of stuff. How many drops did it take? And you just drop one in, and then you drop one in, and then you drop one in, and you count them, and you get to 14, 15, 16, whatever your number is. And then all of a sudden, you put one more drop, and it drops in there, and then all of a sudden the solution, the whole thing turns blue. It's like it took 15 drops to make it turn blue. 14 drops, it stayed clear. But that 15th drop changed things. And it gets into the chemistry and the moles and all that stuff, right? And that's the part that some of us didn't get too good. That's the chemistry that I'm talking about. The chemistry of one of the massive ones is the chemistry of insulin. If you have insulin in your bloodstream versus if you don't have insulin in your bloodstream. The End of Alzheimer's book with Dale Bredesen that we broke down last week says it's one of the major factors in Alzheimer's. And why would you have insulin in your bloodstream? You would have insulin in your bloodstream because glucose is up. And your body's trying to get that glucose out of your bloodstream. So you're trying to get that thick, sticky blood to thin out a little bit. So there's a mechanism there. Like, and you can say, well, I've got low testosterone, low T, right? That's chemistry. If you have normal T, then you've got all this energy and your body works right and your sex life is great and all this stuff is good when you have the normal amount of testosterone. But if it's really low, or one of my ladies today, she had an excess amount of estrogen. It's double what it's supposed to be. Okay, that chemistry is off. There's too many molecules that are um, binding to receptors that is causing this issue that's going on in the body, right? That's the chemistry, and it really is affecting us. Like it is whatever your problem is, whatever health issue that you may be dealing with, there's a chemistry component to it. Because one of my people said, "Man, I started taking vitamin D and I feel so much better." I'm like, yeah, you didn't have enough of that substrate. You didn't have enough of that dropper. You just had fish oil is the same thing. Fish oil all the time. People say, "Well, I took a fish oil pill," and I'm like, "Yeah." But what I want to show you tonight is some of the answers. It's like there's a certain level that you have to take, right? So let's get on with this article, and I want to use it. I want to use the article as a teaching tool to talk about chemistry, not to try to convince you to take fish oil again. Okay, if I haven't convinced you yet, then I'm probably not going to, or you're just brand new to the show. Everybody that's seen the show for a while is like, I get it, Jason. That's a lot of. I get it. I'm going to take my fish oil. Yes, but so I'm not talking about that. I just think it's really cool when it starts breaking down things like chondrocytes. They little cells. Just understand that a chondrocyte is a certain kind of cell in your body. Chondrocytes maintain cartilage. Okay, what's cartilage? It's that um, that padding that you have in a joint, like in your knee. When you hear people say bone on bone, it's bone on bone. What does that mean? Well, you've worn out all the cartilage. Why did you wear out all the cartilage? Is it only because the knee was moving improperly over a period of time? No. Don't kid yourself on that. It wasn't only because the knee was moving improperly. It was because the knee was moving improperly and the chemistry was wrong. Um, you ever like if you this shirt, if you took this shirt and dunked it into diesel fuel, just dunked it into diesel fuel and then hung it up on a clothesline. Do y'all think that's funny that sometimes we say these words that are so old, like a clothesline? Like I know the young people might be like, "What is that?" But all the rest of us, like, of course, you just hang it up on a clothesline, right? Like it's funny. It's like I don't know. Anyway, sorry, but you take this shirt and dip it in diesel fuel and hang it up on a clothesline. What is it going to do to the fabric of the shirt? We're not even moving the shirt around, right? But we got the fabric of the shirt is just gonna eat away. Like if you were to take that shirt and I try to put that shirt on with that diesel fuel after it's been hanging out there for a week or two, like it's just gonna be soaked and nasty, and then it might just deteriorate. There might just be holes in it, and that's what it's saying here. Is that chondrocytes, these particular cells, maintain cartilage. Okay, fair enough. That's not difficult to understand, right? The homeostasis means the balance of the whole thing, right? It maintains this cartilage balance by constant matrix synthesis and degradation. What does that mean? It's constantly making new matrix and getting rid of old matrix. It's like making new parts and getting rid of old parts. Your red blood cells last 120 days. The lining of your intestine lasts 3 days. These are not 54-year-old whiskers. These are not 54-year-old fingernails. Our bodies are constantly breaking themselves down and building themselves back up. Does that make sense? So if you've got chondrocytes maintain cartilage, homeostasis, by constantly making new cartilage and getting rid of old cartilage. That's all that's saying. And you don't have to be a straight A student to figure that out. It's like, okay, wait a minute. these little cells maintain the cartilage in my knee. So what environment do I need to put these little cells in to make sure that my knee doesn't wear out? And then because that cartilage, that collagen represents 50% of the cartilage tissue. That's what I was saying last night, right? Within the water component of the tissue, inorganic salts are dissolved and allow for nutrients to move through the layers of the cartilage. So I don't want to go, I mean, that's what we talked about. We talked about the violet lasers and all that sort of thing. Then we got in, right at the end of the show, we got into the pro-inflammatory cytokines because of the omega-6s and the omega-3s. The omega-6s promote the chemistry. Is the omega-6 is like the dropper that drop 15 drops of that into your joint, and all of a sudden your joint is going to turn into inflammation. What is that? How? Well, it's going to, you've got these little cytokines, like these little chemicals. You've got these little drops, and that interact. When that dropper drops into the solution, it interacts with the solution, and the interaction of the solution causes pro-inflammatory cytokines, including these interleukin-6 and tumor necrosis factor alpha and interleukin-1 beta. That will stimulate a multitude of chemokines, that's just a signal. The cytokines and the chemokines are just signals to cause a migration of additional pro-inflammatory cells to activate catabolic enzymes, breakdown. Anabolic, you've heard of anabolic steroids, makes a dude blow up, right? Catabolic means break it down. So what is that sentence saying for us? What that sentence is saying for us is that if I accumulate too many omega-6s in my joints, I'm going to create an environment inside my joint that is going to break down the cartilage in my joint. That's the definition of arthritis. Inflammation in the joint, right? Not the degeneration, the inflammation in the joint. So it's like, how do I get, what is it doing to me, right? Pro-inflammatory cytokines, one of the most abundant in the pathogenesis of osteoarthritis, as well as many other diseases. Almost all of them. Almost all the diseases we have. Doesn't make any difference which part of your body. Just pick a part of your body that you could get a disease in. You could get diseases in your skin. You could get diseases in your fat. You could get diseases in your bone. You could get diseases in your organs. Right? You could have a disease in your teeth. You could have a disease in your eye. You could have a disease in your ear. Every one of those diseases, wherever they may be, has an inflammatory response. Alzheimer's disease has an inflammatory response. Parkinson's disease has an inflammatory response. High blood pressure has an inflammatory response. Heart disease has an inflammatory response. Acid reflux, Barrett's esophagus, where you get too much acid in your esophagus and it burns a hole in your esophagus. It burns a hole in your esophagus. It inflames a hole into your esophagus, right? So when we have a chemistry inside the body that is pro-inflammatory for long periods of time, it breaks down the body. It's not craziness. It's just chemistry. So what does it mean? Okay, what does it mean? And I'll try to cover this quickly, and then we'll I don't know. I think it makes sense. It just makes sense. Let's leave this up here a little bit and see what I can do. No. Right. Let me roll it up just a little bit. Okay, so just any product, and I pick on peanut butter and corn chips a lot. Let's just talk about corn chips. Corn chips. What is a corn chip? It's a chip. It's corn meal that's deep fried in vegetable oil. Which in vegetable oil, there is no vegetable in vegetable oil. There's corn in vegetable oil, right? So now we're frying the corn. So, but what you're going to get is you're going to get about 84 to 1 omega 6 to omega 3. The omega 6 content in the chips are great. Everybody loves chips. Who doesn't love chips and salsa? Like, it's like, come on, like, it's like fabulous, right? How about some chips? We'll just have some chips and queso tonight. We'll just have some chips with our sandwich. We'll just have some chips and just have some chips. We're hungry. We'll just get a snack. We'll just grab a bag of chips and just eat some more chips, right? What are we doing to the chemistry in the body? Inside the body, what we're supposed to have is a 3 to 1 ratio of omega 6s to omega 3 or less. We're really supposed to have a 1 to 1 ratio. But now we've got this overabundance of 6 for an extended period of time. And what do we get? We get inflammation from that right there. And then our joints start to hurt. And then what are we going to do to control our joint pain? We're going to take acetaminophen, take our Tylenol. I'll tell you how that is bad for you when we come back right after the break. You guys stick around. This is Life with Jason Clemens, DC. We got to take a break here for just a second, and then we'll be right back, and we'll keep it going. If you guys are new to the show, we do a live radio show at the same time as we're doing our social media stuff. And so the radio station takes a break halfway through the show, and they do a few commercials. And so we take a break with them. I'm listening to all that right now in my headset. I know you guys on social media don't hear any of it, but so this is a chance to get some of the questions answered. So it says here, Isabel says, so at what point does the supplements overtake the chemical balance where the medications are messing up the balance? You know, you don't, I know you don't say stop medication. So when is it supplements make the cells no longer needing the medication? That's a really good question. And I will answer that question like this. And you're right. I did not tell you not to take your medication. That's between you and your medical doctor, right? But what would happen if you gave a healthy person a medication? Like, what would happen if you gave a healthy person a high blood pressure medication? It would push their blood pressure too low, right? What would happen if you gave a healthy person, say a person has low thyroid, and then you give them a thyroid medication to bring their thyroid up? But what would happen if you had a person that had regular thyroid and you gave them a thyroid medication? It would push it too high, right? Well, that's one of the ways that you can kind of tell when you start to get healthy. If you're serious about getting healthy, then what you have to do is you have to start tapering off. And I highly recommend it. I mean, you could do it by yourself, but I don't recommend that. I recommend you work with your medical doctor. Now, if you have an awesome medical doctor, which there's lots of awesome medical doctors out there, if you have an awesome medical doctor, they'll help you with that. If you have a less than awesome medical doctor, you have to understand wellness takes away money from sick care providers. And they're not going to be all that excited about you not needing their services, right? It's like, how many times did my daughter go to the pediatrician from the 1 year well check till she's 24 now? From her 1 year well check to, let's say, 18 when she graduated high school. How many times did we go to the pediatrician's office from her 1 year well check to 18? 0 times. Our pediatrician did not make a single dollar off of us in 17 years. So it's some of those guys that's like, man, if everybody goes to wellness, like how are we going to pay the car payments and the electric bills? Hang on one sec. Okay, everybody, we're back. This is Life with Jason Clemens, DC, and we got a question tonight. How do I know if I start doing healthy things, start taking some supplements? How do I know when I start to cut back on my medication? That's basically the question. And my my statement is you need to work with your medical doctor, tell them what you're doing, and then you need to start to gauge those things. What was the criteria by which you took the medication? What was the test that your doctor ran to determine that you needed this medication? Whatever that test was, if it would have been within normal limits, your doctor wouldn't have given you a drug. If you go to the doctor and your thyroid is within normal limits, your doctor's not going to put you on thyroid medication, right? If you're not complaining of acid reflux and burning chest pain and all that, heartburn, then your doctor's not going to put you on a proton pump inhibitor. They're not going to try to decrease your acid. So you would, that's how you would kind of gauge that. As you start doing healthy things, then you don't have those. Healthy people don't have acid reflux. Healthy people don't have low thyroid. Healthy people don't have high blood pressure. Like it's like none of those things take place in. So you kind of got to gauge it as you start to get well. Now the thing about it is, getting well doesn't take very long. Like it really doesn't. Like you could completely reverse type 2 diabetes in 8 weeks max. Like if you've got type 2 diabetes and you went to the doctor, what did they do? They ran a blood test. They said that your glucose level was high, your insulin was probably high, your A1C was high. And nowadays it's all about the A1C. We got the A1C, we got this 5.7 target, and if you're below 5.7, you're good. If you get above 5.7, if you get to 6.2, now you're pre-diabetic. Now you start to get up to 7, and now you're diabetic. If you're 8, 9, 10, then you're diabetic. Then most of the time, you get some sort of diabetic medication, and it's like, all right, well, you're on it for life. And then what happens? You get your diabetic medication, and you come back in 3 months, and we run your blood work again. So then you run your blood work again, and your A1C is down, and they're like, okay, good job. You got your A1C down because of your medication. It's like, well, okay, that's one way to do it. You're going to still eat the same crap that you ate that got your blood sugar up, but then you're going to push it down with the medication. Now you've got this twist going on inside your physiology. It's like, so how would I know that? If I started doing healthy things, it's like, man, I might not feel well on this medication, and then I would need to get off of it. It won't take long at all. Okay, let's get back to the conversation of, and Isabel, I will get you that answer that you asked me last night about those supplements. I just didn't know how much the shipping was to Austin. So I've got the cost of the supplements, but I just don't have my ship. So I'll have to find that out, and then whatever that is what I'll get it to you for. But let's get back to the chemistry conversation. The corn chip has a high omega-6 component. The omega-6 is the part is the chemistry that drives the inflammatory process. The more sixes you have, the more arachidonic acid you have, the more inflammation you have. The more inflammation you're going to have in your body. And what does it mean? It means that we need this ratio to be proper in order to keep our joints from being inflamed. And when we eat these foods that are high in these omega-6, this is omega-6, when we eat an 84-to-1 omega-6 food, or a 1700 or 4400 to 1 in our peanuts, or any of those high omega-6 foods, what we're going to end up with is we're going to end up with this ratio that's out of balance. Our chemistry gets out of balance. And when the chemistry gets out of balance, the physiology of the body changes and we express a symptom to let us know that we have the body in an environment that's incongruent with health. That's something that we're not taught properly. We're not taught that symptoms is like your light that comes on your dashboard. A symptom is a signal that your innate intelligence, the wisdom of your body, is giving to you to tell you that you've got me in an environment that's incongruent with health. What does it mean when I say that? The environment is the internal and external environment. It's the physical, chemical, and mental emotional environment that my body is in. The combination of those three things, the combination of those three things is either going to put the cell into an environment that the cell will express health, or it'll put the cell into an environment where the cell will express sickness. The cell will express stiffness. If you're sitting in a chair and you stand up out of the chair to go fill your tea up in the kitchen, and it hurts your feet to stand up and walk, if it takes you a second to unwind your hip and stand up and walk. If you get out of bed in the morning and it hurts to stand up out of bed, it hurts your feet to stand up out of bed. That's the environment that I'm talking about. You've got your body in an environment that's incongruent with health. Now, if you just did a hard workout yesterday and your legs are sore because you did this hard workout, then it's like, okay, well that makes sense, right? But otherwise, that when I say if you put the cell in an environment that's congruent with health, the cell will express health. I don't know if everybody understands that, because I think maybe that's a little bit maybe that's a little bit too complicated, or I don't know. Maybe sometimes I think, well, maybe it's not making it. Well, you don't understand that that's talking to you, right? And so, what are you going to do if your joints are stiff? You're going to take a Tylenol, right? Well, let's just talk about that for just a second, because you don't get this much, but frequency of analgesic use and risk of hypertension among men. This comes from the Archives of Internal Medicine, February of 2007. Wait a minute, what did I just say? What did that just say? The frequency of taking these non-steroidal anti-inflammatories and the relationship that it has with high blood pressure. So this comes from Harvard Medical School. These authors are associated with Harvard Medical School, 2007, right? And they identified that 1,968 incidents of hypertension, high blood pressure. They found 1,968 people with high blood pressure. After adjusting for all the different things, men who used acetaminophen 6 to 7 days per week compared to non-users had a relative risk for incident hypertension of 1.34, which means a 34% increase in hypertension. You increase your chances, according to the Harvard Medical School people in the Archives of Internal Medicine, you increase your chances of increasing your hypertension, your high blood pressure, by 34% if you were to take acetaminophen 6 to 7 days in a row. Okay, why would you take acetaminophen? Why would you take Tylenol? Because your joints hurt. Why do your joints hurt? Because the chemistry's wrong and the movement's wrong. Right? The majority of people who have knee pain or shoulder pain or hip pain or neck pain, and they want to get rid of the pain, will go to taking their NSAIDs in some form or fashion. So you take your Tylenol, which is acetaminophen, for the pain. And what do you get? If you do that 5 days in a row, 6 days in a row, 7 days in a row, you increase your chances of increasing your blood pressure 34%. Wouldn't it make more sense if we figured out why it was that we were taking the acetaminophen in the first place, and then figured out a way to solve that problem. Now we're killing two birds with one stone, as they say. Now we're getting rid of the joint pain, and we're staying away from the possibility of increasing our blood pressure. It's like, okay, the same comparison resulted in relative risk of 1.38, 38% increase for non-steroidal anti-inflammatory drugs, and 1.6, 26% increase for aspirin. I don't understand this whole aspirin a day thing. Like it from a health and wellness standpoint, like, doesn't make any sense to me. We observed similar results when the number of pills per week was analyzed rather than the frequency of use in days per week. So if you took Tylenol 3 or 4 days 3 or 4 times in a day, it still held up, right? The conclusions: the frequency of non-narcotic analgesics use is independently associated with a moderate increase in the risk of incidence of hypertension. And then the author's note said this: acetaminophen, ibuprofen, and aspirin are the three most frequently used drugs in the United States. These drugs may increase blood pressure. Non-steroidal anti-inflammatory drugs increase renal sodium reabsorption. Acetaminophen increases cellular oxidative stress. Listen to that statement, because that's a big statement right there. Acetaminophen increases cellular oxidative stress. What does that mean? What does that mean to us? Here's what it means to us. Let's go back to our famous picture that is one of the most important pictures in your life. Your cell, your nucleus, your DNA, your mitochondria. The mitochondria make the ATP. That's the power plant of the cell, right? So what does that sentence say? That sentence says acetaminophen, and this comes from the doctors at Harvard Medical School associated with them, acetaminophen increases cellular oxidative stress. That's what that's talking about, is this antioxidant issue and this free radical issue, or reactive oxygen species that damages that mitochondria. That's another thing that damages the mitochondria. You damage the mitochondria, you damage the ATP, you run out of ATP, you run out of energy for the cell, it's dead. What am I going to do? My phone is at 32% right now. My phone's at 32%. My office phone. My personal phone is at 73%, because we've been using our office phone all day long, and my personal phone's been sitting on the desk while I've been working on people. Okay? What am I going to do with that cell, with that phone, if that 32% goes to zero? I'm going to have to charge the phone. What if I can't charge the phone? What use is this phone if it's got no battery? Like, if you just turn this phone off and it has no battery, I don't know, maybe I could use it as a paperweight. I could just like weigh something down with it. Maybe I could use it as a rock or something, and if I wanted to try to skip it or throw it at somebody, I could use it as a weapon. I'm not going to hit you with it. I can't use it as a phone because it's got no power. It's basically dead. If you turn the cell, if you attack the mitochondria and you turn the power off to your cell is going to die. And now you can't use it anymore. So what does this sentence say? The sentence says acetaminophen increases cellular oxidative stress. Yep, that's not good. It's not good for us right there. Both acetaminophen and NSAIDs impair endothelial function. What's endothelial function? Endothelial function is the lining of your blood vessels. It's the lining of your intestines. It impairs those things. 2 large prospective female cohort studies have documented an association between the frequency of analgesic use and the risk of developing hypertension in females. 2005, a large cohort of male physicians noted a significant association between frequency of acetaminophen and the risk of hypertension. Right? We don't want to do that. We don't want to do that. Men who took 15 or more pills per week compared with men who took 0 had an increased risk of hypertension by 48%. But they took the pills because of the pain they were in. And the pain they were in is related to, in a lot of cases, it's related to inflammation in some form or fashion, and it's also got the nerve involved. And when it has the nerve involved, it's a disruption in the fuel and activation of the neuron, the nerve. The nerve is not getting the proper fuel, or it's not getting the proper activation, and now the nerve is malfunctioning, which is painful. If you've ever had a neuropathy, that's painful. You'll want to take acetaminophen to get rid of your neuropathy, which is going to cause you to have high blood pressure, and then it mess up your endothelial lining of your intestine and your vessels, and then you're going to have to go get another drug to battle your high blood pressure that's being caused from the fact that you ate too many corn chips. And I didn't invent the science. I know sometimes you just wrap it around, and it's like, that gummit, like it comes back to the same thing, right? So it's like, well, how much fish oil, and I'm not trying to talk about fish oil, but how much fish oil would it take? Is there any data out there that gives us a little bit of information about how much fish oil would it actually take? Well, here's an article, a meta-analysis of the analgesical effects of omega-3 fatty acid supplementation for inflammatory joint pain. Now, what did we just say? We were looking at Tylenol and ibuprofen for inflammatory joint pain, which is osteoarthritis, right? That's what we were talking about, this whole inflammatory joint pain thing that we've got going on. Well, here's an article in the journal Pain, May of 2007, that says, hey, wait a minute, omega-3 fatty acids has an effect on inflammatory joint pain. So what does it mean? Between 40% and 60% of Americans use, here's my favorite, complementary and alternative medicine to manage medical conditions, prevent disease, and promote health and well-being. No, they don't. That's a hogwash crap sentence, if you ask me. 40 to 60% of Americans use health things to promote health and well-being. It's not alternative. It's all, you hear how ridiculous that is? It's complementary and alternative. No, it's not. Tylenol is complementary and alternative in my world. Like, so, no, I'm sorry. I don't mean to get intense, but omega-3 fatty acids have been used to treat joint pain associated with several inflammatory conditions. Why? So let's don't talk about the fish oil. Let's talk about the chemistry. Why is it that omega-3 fatty acids have been used to treat pain associated with several inflammatory conditions? Well, let's go back to our other article. Let's go look at, I think it was this one. No, archives frequency of analgesic. Let me see. I got too many articles opened up. There it is. All right, this is the one we started with. Nope, that's not it. Sorry, hang on. That's not it. That's one in athletics. I'm sorry. I got too many tabs open right now. Because there's the reason I have too many tabs open right now is because there are hundreds and hundreds of articles talking about this effects. But what are the effects? And this is the one we were on. So you go down here, omega-3 fatty acids are metabolized to anti-inflammatory series prostaglandins. The chemistry. Why does fish oil help with joint pain? Because the components in the fish oil will be broken down into anti-inflammatory chemicals that resolvins, protectins are among the metabolites of oxylipins, classified as special pro-resolvin lipid modulators. That's too much stuff. The EPA and the DHA act as agonists to peak periods of inflammation. We're just basically decreasing all of the inflammatory chemicals that are causing our problems inside the body by adding the fish oil to it. Now I might not. All right. Let me get rid of that one. And yeah, that's the one we were on right there. Because I wanted to show you that the science or the research on this meta-analysis from Payne. Yeah, that's it right there. So the research on this, where it comes down to the bottom, author's notes, or wait, let me go. The results suggest that omega-3s are attractive adjunctive treatment for joint pain associated with rheumatoid arthritis, inflammatory bowel disease, and dysmenorrhea. 33% of those who use complementary medicine cite pain as the primary reason. I hate that sentence. Let's go down here. Where was it? I was reading. Studies that provided high dose of omega-3s greater than 2.7 grams per day of EPA and DHA showed greater improvements in morning stiffness and number of painful and or tender joints compared to low dose omega-3s. That's the sentence I was looking for right down here at the bottom. The studies will say it's greater than 2.7 grams, which is 2,700 milligrams. So that's why the baseline in the fish oil for our office, the baseline of the fish oil is 3,000 milligrams. Why did I say that? Where did I come up with 3,000 milligrams? I came up with 3,000 milligrams in these studies done by these doctors at Harvard and all the rest of these other places. Studies that provided high dose, more than 2.7 grams a day of EPA and DHA. Meaning our titration of the fish oil, you got to have enough drops. If you have 14 drops and you need 15 drops to turn the solution a different color in your titration, if you have 14 drops, it doesn't matter. It's not going to change. If you have 8 drops, it's sure not going to change. Right? So you have to have a certain number of drops to change the solution in the titration. Same thing that goes on in the fish oil. And according to the research on the fish oil, it's 3 grams a day. It's 3,000 milligrams to get to the level that you need to. So, and that's why I always buy, like the ones that we choose, I'm looking at it and say, how can I get to 3,000 milligrams? This one together is 2 soft gels will get me to 2030. So I need 3. That's basically 1,000 per soft gel of EPA and DHA. So I take 3 soft gels every day. If I use orthomolecular, then I add those 2 things together. 1 soft gel gets me 820. It's almost there. It's not as intense as this one. But it's 820. So I need 4 of these to get me there. That's how you dose your fish oil. If I'm taking it in a liquid form, I would say, all right, well, how much is this? This is 29.25. This is almost 3,000 milligrams just for 1 teaspoon of the liquid fish oil. Go look at your bottle. If you got any fish oil at your house, go look at your bottle right now and just add the EPA and the DHA up. Don't add anything else inside the bottle. That's what it's talking about right here. 2.7 grams of EPA and DHA. I don't care about anything else in the bottle. That's when you get serious fish oil, because a lot of fish oils will say 2,000 milligrams of the fish oil, but then you look at it and it's only got 400 of EPA and DHA. If it's 400 and you're going to get to 3,000, you got to take 8 pills, right? So you got to. That's the chemistry part, and it's sometimes it's a little hard to talk about. Sometimes it's a little hard to talk about the fish oil without sounding like you're trying to sell fish oil, and I'm not. I'm just trying to talk about the chemistry of it. The chemistry inside the body is a really big deal to the way that the body works. It really does make a difference. It really does make a difference in how your brain works. It really does make a difference in how your joints work. And it really, if you will control the chemistry inside your body, you will keep yourself away from a lot of the medications that have side effects that cause more trouble in your body. That's all I got for you tonight. I'm out of time. I hope that was helpful. And thank you guys for watching the show. If there's anything I could do to help you, please let me know. 806-794-0400 is our phone number, or you can send me a message on social media. You guys have a great night. We'll be back tomorrow night.